I'm Professor Lee of Dr. Wildlove TV. Top 10 medicinal plants worldwide proven to improve high blood pressure. This is the first lecture on how to use it. Let me tell you characteristics of antihypertensive herbal therapy. 1. It has the same mechanism of action as a prescription drug, but in addition, it has effects that drugs do not have. 2. The greatest effect appears in pre-hypertension and stage 1 hypertension. 3. It has a synergistic effect when used in combination with drugs. 4. There is a synergistic effect when used in hypertensive complication patient. In today's first lecture, before introducing individual medicinal plant therapy, let's study the diagnosis and treatment guidelines for high blood pressure and the effectiveness of non-pharmacologic treatment. Let's get started. In terms of risk contribution to the cardiovascular disease, the number one cause of death worldwide, high blood pressure, is most important. It is 5 to 6 times higher than diabetes and up to 2 times higher than hyperlipidemia. Assuming that diabetes contributes to the occurrence of cardiovascular disease as 1, in men, hyperlipidemia is 5 times higher and hypertension is 5 times higher. In women, hyperlipidemia is 3 times higher and high blood pressure is 6 times higher. The risk of having a stroke from high blood pressure is much higher than from cardiovascular disease. In other words, it is 5 to 8 times higher than diabetes or hyperlipidemia, and the risk is higher in women than in men. According to some studies, when systolic blood pressure decreased by 10, the risk of stroke decreased by 30 to 40%. Quiz. Among the following diseases, which one needs to be treated with the most care to avoid cardiovascular disease or stroke? 1. Diabetes. 2. Hyperlipidemia. 3. Hypertension. 3. Hypertension, right? Now, I'll tell you about the diagnostic criteria for high blood pressure. Normal is systolic blood pressure below 120 and diastolic blood pressure below 80. High blood pressure is a systolic blood pressure 140 or higher, or diastolic blood pressure 90 or higher. If the diastolic blood pressure is less than 90, but the systolic blood pressure is more than 140, it's called isolated systolic hypertension. Pre-hypertension is when your systolic blood pressure is 130 to 139, or your diastolic blood pressure is 80 to 89. If the systolic blood pressure is lower than pre-hypertension, but higher than normal, it's called cautionary blood pressure, and the systolic blood pressure is between 120 and 129, and the diastolic blood pressure is less than 80. Looking at our country's statistics in 2029, 1 in 3 adults has high blood pressure. 1 in 2 people over 60 years old has high blood pressure. 2 out of 3 people over age of 70 have high blood pressure. There really are a lot, right? If you took the subway or bus, 1 in 3 adults around you has high blood pressure. Please look at the following criteria carefully and check whether you belong to 1 out of 3 people. 1. The average value of 3 consecutive measurements at 1 minute interval after resting for 5 minutes is the standard. 2. If your blood pressure was measured at the hospital, systolic blood pressure is over 140 while your diastolic blood pressure is over 90, you have high blood pressure. When measuring at home, the standard value is different. Systolic blood pressure is over 135, diastolic blood pressure is over 85, you have high blood pressure. Why we need to treat high blood pressure? 1. Prevent cardiovascular disease. And 2. If it already exists, is to prevent disease progression and recurrence. Lowering systolic blood pressure by 10 to 20 and diastolic blood pressure by 5 to 10, the risk of stroke is reduced by 30 to 40%. The risk of developing cardiovascular disease is reduced by 15 to 20%. In the case of prehypertension, drug treatment is not required, but lifestyle therapy is required. However, there are exceptions. If you have cardiovascular disease or chronic kidney disease, drug treatment should be considered. Anyone who passed the prehypertension stage has high blood pressure, require medication. However, there are exceptions that do not require drug treatment. Stage 1 hypertension is when systolic blood pressure is 140 to 159 and diastolic blood pressure is 90 to 99. However, if there are no risk factors, drug treatment is not administered from the beginning. In other words, try lifestyle therapy for 3 months first, and if there is no improvement, take medications. Each individual has different target values when treating high blood pressure. This is when the systolic blood pressure should be less than 140 and the diastolic blood pressure should be less than 90. Based on home blood pressure, systolic 135, diastolic 85. This is the case for people with high blood pressure but no complications. For examples, no cardiovascular disease, no stroke, and no chronic kidney disease. There are also exceptions. Even if there are no complications, the target value are less than 130 systolic and less than 80 diastolic in the following cases. 1. High blood pressure with 3 or more of the following: 35 years old for men, 55 years old for women, family history of cardiovascular disease, smoking, obesity, hyperlipidemia, diabetes. 2. Cases with asymptomatic organ damage, such as brain MRI abnormalities, hypertensive retinopathy stage 3 or higher, albuminuria, arterial calcification, or arteriosclerosis index positive. Diabetes but asymptomatic organ damage or one or more cardiovascular risk factors. In people with complications, target value are less than 130 systolic and less than 80 diastolic. Exceptions: if you have chronic kidney disease without albuminuria, target values are systolic less than 140, diastolic 190. Based on home blood pressure, systolic is less than 135 and diastolic is less than 85. From now on, I'll talk about lifestyle therapy. A good lifestyle strategy can reduce blood pressure by about 1 prescription drug. The most important thing about diet is to eat less than salty food. If you look at the ranking of sodium content by food ingredient, all essential food ingredients for Korean are high in sodium. This table ranks sodium content by type of food eaten out. Jampong is the highest, and all food with soup have high sodium content. You should know that it's important to eat less soup. This data from the British Heart Foundation. Processed meat and bread are the highest in salt. This is data from the American Heart Associations. Here too, bread, pizza, sandwiches, and processed meats are high in salt. First of all, you need to eat less salty food. The average daily salt intake of Korean is 10 grams. They eat much salty food than Western people. The goal is to eat less than 6 grams. It's about amount of 1 teaspoon per day. Then the systolic blood pressure decreased to about 5.1 and diastolic blood pressure decreased to about 2.7. 2. Reduce animal fat and eat fish, tofu, vegetables, fruit, and nuts. Then, reduce systolic blood pressure by 11.4 and diastolic blood pressure by 5.5. Synergistic effect when consuming potassium, calcium, and magnesium. How much will my blood pressure decrease if I reduce the amount of alcohol I drink? 1 bottle of beer, 1 glass of wine, 1 glass of 정종, 2 shots of whiskey, 2 to 3 glasses of soju. If you do not exceed the above drinking amount, your systolic blood pressure will decrease by 3.9 and your diastolic pressure will decrease by 2.4. This time is the effect of exercise. If you do aerobic exercise for 30 to 15 minutes a day, more than 5 days a week, systolic blood pressure decreased by 4.9 and diastolic blood pressure decreased by 3.7. Just losing weight can reduce your blood pressure. For every 1 kilogram lost, systolic blood pressure decreased by 1.1 and diastolic blood pressure decreased by 0.9. If you make good use of herbal remedies, 1. You won't take the medicine, 2. You take less medicine. The next lecture is part 1 of herbal treatment for high blood pressure. Thank you for watching. Stay healthy everyone and see you next time.